Hello. So I have a patient here with me who has been getting pellets for a while now, and she has been gracious enough to share with you guys what symptoms she was having before the pellets and how the pellets have helped her. So April, tell us, what symptoms were you experiencing prior to getting the pellets?
Okay, so the beginning was I had just had a hysterectomy, and during the season of my body getting adjusted to the hysterectomy with the hot flashes, I incurred tremendous sleep apnea, sleep deprivation. The hot flashes were out of this world. I mean, they were all day, and super fatigue. It wasn't that I was sleepy, but I was tired, zero energy. So Dr. Cook introduced me to, at that time, I think it was Bioidentical pellets.
Mm-hmm.
Yes.
Yes. And so with the pellet therapy, there are several different advantages. One of the advantages is that it's an all-natural source. The hormones actually come from a plant source. The hormones also are made to mimic what our bodies were doing for us when we were in our 30s, right? So we're in our 30s, both the ovaries and the adrenal glands work together to give us testosterone. Guess what? We never talk about testosterone in women. Most women don't even realize that we make testosterone. But testosterone does have an impact on sexual libido. So one of the things that happen to women as we go through menopause is that we no longer have the desire for sexual intercourse. We also experience vaginal dryness. So now not only do we not have the desire, but intercourse is painful. And so with testosterone, it really helps to increase that libido, that sexual desire. It helps with that vaginal dryness, so it helps to make sex more enjoyable. And then we also have estrogen in the pellets as well for a lot of our patients. And so that's what helps to alleviate some of those hot flashes that April mentioned. And so I want to just spend some time and do future videos as well, because I really do think it's important for us to be able to embrace all different phases of our life, right? So even the transition into menopause. And it doesn't mean that we shouldn't care about sex anymore. It doesn't mean that we should suffer through feeling miserable, not having energy. And so I really thank you, April, for just agreeing to share your experience. Tell us how the pellets have impacted your life now that you've been getting them.
Oh my gosh. The biggest thing, even before the impact, was that when we had our numerous conversations about it, knowing that breast cancer runs first line in my family, and I knew I did not want to take the hormone tablets. So when Dr. Cook introduced me to this natural medication, that just that I wasn't frightened about getting it done. But now, I look forward to every 3 to 4 months, and I've been getting the pellets since 2016, I believe. Yes, and so when I get them, overnight I can instantly tell that it's regulating my system, my hot flashes, or the feeling of what we call flipping in and out of the bed with the cover. I feel better. I'm able to sleep at night. And maybe 2 to 3 days later, my energy comes back, my vitality comes back, my sexual appetite comes back. So, I love it. And I can tell instantly when it's time for me to get my revision done.
Yes. Alrighty. So April has also been gracious enough to allow me to show the process of what getting the pellets looks like. Because a lot of times patients are also a little fearful, does it hurt? So I'm just going to allow you guys to actually see what that process looks like.